Transcatheter aortic valve replacement is now an established clinical strategy in Europe. More than 6,000 patients have already received a transcatheter valve, either via the transfemoral or transapical route. Two manufacturers are leading the pack, the Edwards Lifesciences Sapien valve and the Core valve. The two valves differ in a number of respects. The Edwards valve is balloon expandable, is usually placed via cut down on the femoral vessels, which must be about 8 to 9 millimeters in diameter to safely accommodate the relatively large sheath and the valve. The Core valve is self-expandable and smaller, and the smallest valve size can be placed through an 18 French introducer, making it truly percutaneous. Neither of these first-generation valves is repositionable or replaceable, and once deployed, there is no turning back. Newer valves, such as the direct flow and Sadra valves, promise to be smaller and can be repositioned and removed if placement is not proper or if sizing is incorrect. So far, there has been no randomized trial data which justifies the use of transcatheter valves. However, in Europe and Canada, their successful use in high-risk or non-operable patients has already earned the Sapien and Core valve the CE mark, which allows clinical use and marketing. Recently published data from Canada has described the most recent outcomes in 168 patients with severe aortic stenosis and high surgical risk. The data show that patients being treated with transcatheter technology are elderly with a mean age of 84, about a third were treated with femoral cut-down, and the remainder with transapical implantation. In this report, the overall success rate was 94%, with an intraprocedural mortality of about 1%. Interestingly, 30-day mortality was 11% and was lower in the transfemoral group, with a mortality at 30 days of 8 versus 18% in the transapical group. Though at first glance, this might not seem obvious. Remember that patients in the transapical group all have iliofemoral atherosclerotic disease, severe enough not to allow them to have transfemoral valve insertion. Peripheral vascular disease identifies a patient population with higher risk and explains the higher early mortality in that group. Operative mortality was almost identical at 30 days, 11%. There appears to be a learning curve for the procedure in that overall mortality fell from 14% in the initial half to 8% in the second half of the experience. Functional class improved over the 1-year post-procedure period. Survival at 1 year was 74%. The bulk of late readmission and mortality was not procedure or valve related, but rather was due to comorbidities. No surprise. Paravalvular regurgitation was commonly seen but generally mild and remained stable at late follow-up. At a maximum of more than 3 years and a median of 221 days, structural valve failure was not observed. The researchers from Canada have concluded that transcatheter aortic valve implantation can result in early and sustained functional improvement in high-risk aortic stenosis patients. Late outcome is determined primarily by comorbidities unrelated to aortic valve disease. In the United States, the Edwards Lifesciences Sapien valve is being studied in a phase 2 randomized trial that has 3 arms. The first arm is for truly non-surgical candidates who are randomized to either transfemoral valve replacement or to ongoing medical therapy, which usually includes balloon aortic valvuloplasty. Patients who are high surgical candidates, defined as having an STS score of greater than 10, are randomized depending on the presence of peripheral vascular disease. Those that can have transfemoral valve insertion are randomized to percutaneous valve or standard surgical care. Those with peripheral vascular disease, which excludes transfemoral insertion, are randomized to surgery or to transapical valve replacement through a mini incision over the left ventricular apex. Clearly, the results of that phase 2 trial will largely determine the future use of transcatheter aortic valve therapy, and the results, which are expected in about 1.5 years, are eagerly anticipated.